seats for the one midwifery education program in Alberta, so many Albertans obtain their training elsewhere. Now, because Alberta has not signed on to the International Midwifery Pre-Registration Program, our internationally trained midwives face a $32,000 bill to go through this process. So my questions are to the Minister of Health. Given the shortage of midwives in the province, is the Minister aware of the number of internationally trained midwives seeking registration in Alberta?
The Honourable Minister.
Mr. Speaker, yes. I met with the College of Midwives and their association representatives a little more than a week ago. It is true that there are a shortage of midwives in Alberta. We are concerned about that. We are also concerned about ensuring that we provide an environment that allows midwives to practice to their full scope of training and expertise. The health professions legislation in Alberta and the midwives regulation is based on the parameters of the scope of practice in the Canadian midwifery framework, and we intend to support our midwives in achieving the ability to practice to the full extent of their experience.
Thanks very much, Minister, for that answer. Again, to the same Minister, well, given that it appears that recently about 9 applicants for pre-registration were advised to apply to bridging programs, which would require that same $32,000, is the Minister considering creating a Made in Alberta pre-registration program?
Honourable Minister.
Good question.
Mr. Speaker, it is a good question, and I have not had any specific discussions with the midwives or their association about a bridging program. What we have discussed is making sure that the midwives who are licensed to practice in Alberta have the opportunity to go beyond the traditional maternity services, maternity support role in our hospitals, and to be able to practice in the community, supporting home births and other alternatives that Alberta women want and expect.
Thank you. Back to the same Minister. Well, wouldn't the Minister agree that this is a perfect opportunity to consider this? We have the existing midwifery multidisciplinary project is under review. We have a brand new College of Midwives. Wouldn't this be the perfect opportunity to create a fair and unbiased pre-registration program?
Well, Mr. Speaker, I'll be happy to take the honourable member's comments about a bridging program under advisement and use that idea along with other issues that we're trying to address in my discussions with midwives. As I said, Mr. Speaker, our intention as a government is to do everything we can to support midwives in practicing to the full extent of their training and expertise.
The honourable member.